Joining us in the studio are two more creatives using different approaches to healing and wellness. We introduce you to Johnny Crowder, the man behind Cope Notes, and Dennis Harton, who is here to talk about emotional vaccines. Gentlemen, thank you so much for joining us.
Thank you for having us.
Explain, Dennis, what an emotional vaccine is.
Well, it's developed out of demand really that surfaced during 2020, but Dr. Mira helped me create, and really he's the brains behind it, right? 30-year duly board certified physician, psychiatrist, and I questioned him one time. He's got 30 years of knowledge in his head, but I can't put him in front of all of my clients, so how do we solve for that? So it became really an evolution that today has turned into these massive library of 350 plus videos in English and Spanish that are about 3 minutes or less, and they're very action focused. It's really how to live a healthy and happy life in kind of 2 or 3 minutes a week, and just constant repetitive small bit sizes of micro learning really that now have turned into even training sessions and a lot of things.
So you said that this started in 2020.
Yes.
This was the start of the COVID-19 quarantines.
Yes.
How did you all decide, what the topics would be? What was the biggest need, and how has that grown over time?
What's fascinating is now that I look at the library, I go back and see and look at the content that's been produced, and because Doc comes up with the ideas or things would be happening in our own lives. It's really, I can actually point to moments where things surfaced with me having new grandkids and my children in relationships and just work-related issues and things that Doc was dealing with. He had, I know you may remember, a couple of massive strokes and walked out of the facility a few days later with no detriment. And so it's just been a lot of things that have happened, just everyday life challenges. And I recognize, being in the insurance industry, that so much of our attention and our focus is reactionary. But NAMI says people will wait 10 years before they reach out for treatment. So how do we get way ahead of that? And I was really focused in our health plans on how do we keep people from becoming diabetic. If we get them healthy and happy, they don't become diabetic. It saves in the health plan. Well, no one talked about the fact that if Dennis is going to become diabetic, it's probably because he ate all the cookies, right? So it all starts in our mind.
Yeah.
And so I really started to put some attention on that and just found there's a massive gap. There's not any discussion around prevention. Johnny's one of the few that I became friends with during some of this journey that is on the preventative side, because everything's so reactionary.
Right. So Johnny is his vehicle that he uses for resilience and mental health care is very different. It's not your video.
Yeah.
It's the text messages. Explain to our viewers what Cope Notes is logistically.
Yeah, it's literally, it says on our website, we text you, you feel better. So it's like we send you one text per day at a random time that contains health education content, so like a psychology fact, a journaling prompt, an exercise that's written by a real peer with lived experience, like someone who's been through it themselves, reviewed by clinicians, based on proven psychology. But the point, like he brought up, is just it's micro content. This is like a 10-second interaction, and what matters over time is that consistency. So I'm kind of a psych nerd. I went to school for psych, and the cool part behind what we do is each of these little interventions trains the brain to think differently. So it trains the brain to combat automatic negative thought and stress, anxiety, depression. And then what's really cool for me, like I grew up with mental health conditions, so I care a lot about like prevention and intervention, like Dennis mentioned, but then I also care about all of the people who say, oh, I'm good, I don't need to go to therapy, I don't need medication, I don't have a diagnosis. I say, great. How are you going to stay happy and healthy and safe? So what's cool is that we've also proven that for people who live with depression, anxiety, and stress, these little 10-second messages can reduce those things. But equally importantly, people who don't live with those things, we can help prevent those things by increasing emotional intelligence, resilience, coping skills, focus. So it's designed to be not like a root canal, because that's like a specialty thing. Yeah. This is like a toothbrush and floss. It's something that everybody with teeth can use.
You're building resilience one day at a time. Explain to our viewers what Cope Notes is. How do you describe it in your typical elevator speech?
It's literally daily text messages that train the brain to combat stress, anxiety, and depression.
How did you come up with the concept of texting when so many people were thinking at that time about creating apps? You didn't go that route.
No, and I want to be clear about what I deserve credit for and what I don't. So I will start with, I deserve credit for, I went to school for psych and I was studying abnormal psychology and neuroscience, like how and why the brain changes. And I learned about something called ecological momentary intervention, which is basically taking clinical learnings, like something you might learn in therapy, but you deliver it in non-clinical settings in bite-sized pieces. So like at home, at work, you're sitting in traffic or you're cooking dinner and something pops up on your phone that makes it integratable into your lifestyle. So I'll take credit for some of that. I won't take credit for making it not an app because I actually couldn't. I went to school for psychology, not technology. So I don't know how to code. So the original version of Cope Notes was like me texting people health education content from my phone. And it eventually became like a technology platform. But I think we were really relieved because at the time, I started working on this in 2017. And everyone was like, it's got to be an app. And I didn't know how to tell them, like, I'm 24 and I don't know how to make an app. But now we look at like how SMS infrastructure has grown and changed, and the likelihood of you reading an app notification is 1/50th the likelihood of you reading a text message. So if we're in the business of delivering health education and interventions, people actually have to read them for them to work. So we're very grateful that we chose texting instead.
So you just said a few seconds ago that the first Cope Notes messages you sent from your phone.
Yes.
At this point, how many years later you've surpassed the 5 million messages?
Yes, we just passed 5 million this week.
And you're not sending, I don't want to imply that you're sending them from your phone.
Can you
but
imagine?
That's really incredible. Over 5 million. Where are the people who are receiving the messages? Is it just here in the US?
So that is another statistic that blows my mind. We have users in 97 countries around the world, which is ridiculous to me. I've only visited a couple, so I can't wait to see the rest. But what's really cool is this started as, I'm from like if you can't tell by looking at me, for like the metal and hardcore and tattoo and skateboard kind of community. So when I built this originally, it was for people from that subculture who were like, I don't trust therapists, or I don't want to go to a church, or I don't want to talk to anybody. And I was like, man, how do I help these people? But then now we're serving like school districts and hospital systems and governments, and it's like 100 times more. It's way more integrated into a lot of people's lives than I originally dreamed. So my dream for Cope Notes was this. What it became is much larger.
And the videos are one of the things that, Dennis, you've said, is that we need to make it easier for people to feel comfortable with the idea of reaching out for something that makes them feel better, mental wellness.
Well, it's really, I think, from our seat, we believe that the answer is our community, right? You really can't, as much as the legislation and the legislators are trying to solve for this, we can't put enough therapists in the community. We can't fund it enough. We can throw all the money at it in the world. There's a massive shortage. And so from our seat, we really believe that we can actually be the first line of defense for those that are around us, right? I'm friends with Johnny. I know if he's having a rough day, I might notice it as a friend of his before he's going to reach out for therapy, right? That's the average Joe that grew up in Kentucky like I did. We learn all of these things the hard way. How much of an impact would it make if we would know it or could learn it ahead of time? We teach our kids, right? We don't put them in cars without car seats, and we put helmets on them, but there genuinely isn't a public health policy around some of this that I have found. And while I believe stigma has gotten better, it's certainly a big topic of conversation, we still don't openly discuss these things. So
things like text, things like videos, kind of meet people wherever they are. So your background is in insurance, the insurance industry. Your background is not in mental health or therapy, things like that. How did your worlds come together?
Yeah, I didn't even study this. I've learned all of this the hard way. If you grow up in Kentucky, we invented a lot of the addictions that I think have spread through the world. And so ultimately, I was asked to kind of lead an addiction recovery group through church that I was wildly ill-equipped for. I was just to moderate the conversation, but I learned people travel down this path. And as I was studying the health plans that I do build for clients in schools, everybody's interested in why is my health plan cost going up? Well, it's very obvious if we don't deal with things that stress and anxiety, they turn into sleep deprivation, and we don't eat properly. And 80% of our claims, people don't know this, are self-inflicted, right? Smoking, high blood pressure, diabetes. And when you look at the rising cost of healthcare, it infiltrates everything that we do. In fact, I didn't share this with you, but coming in, I got a text that the Minnesota shooter went to school with a very close friend of mine's son in elementary in Lexington. it's filtering everywhere. If we don't deal with it at those levels, it's only going to get worse, and we really can't throw enough therapists at it. So if we don't get preventative, then what is the answer? I'm big on, I can't fix the whole thing, right? I know Johnny's done and made massive impacts, but he and I collectively can't fix the whole thing, but we can do some things. And what I believe is the right answer is pulling our community together. Doc has pulled together, we've now developed this Care Champion community where we want to certify the layperson with very basic content that'll allow them to go out and help those that are around them in a safe and healthy way. And that way, the ones that do need therapy can get in front of the therapists we do have.
As you both look ahead, just to round out the interview, as you both look ahead to an area of most need, mental health space has a lot of layers to it. What would you say is the area that you would like to see progress made in? And Johnny, I'll start with you.
Yeah, it's hard to pick, but two come to mind immediately. So I love what Dennis was mentioning. Like, there's lots of people who are unlikely to seek out care. So the important part, like you said, is getting care to them. So for the people who won't go to therapy, for the people who won't take medication, like, what are the options for, like, my ideal ratio of care provider to care receiver is 1-to-1. Like, how great would that be? Everybody has like a buddy. And the closest that we're going to get to that is like symptom self-management. It's like equipping people through health education. So I think, I look at two main areas to do that. One is the education system. I think, like, man, when I was in school, there was like the DARE program, so you're learning about cigarettes, and they show you that picture of the, I don't know that I 100% agree with the way that was done, but I remember it. The picture of the lungs, the cigarette smoke, and I remember that it was part of school. So I think I want to equip kids with this knowledge, and then I want to equip the educators who are sewing into these kids, because a really healthy kid with 4 really unhealthy teachers is probably going to become an unhealthy kid. So I care about the educatees and the educators. And then the same is true in like the care provider world. I care a lot about people receiving care, and I care a lot about the people administering the care, because if those people are burnt out and bitter and exhausted and they're quitting all the time, it affects the quality of care. So I think education and healthcare, but then I think specifically the people who are receiving the services and the people who are giving them.
Dennis, in the arena of insurance and paying for things like preventative mental wellness, what would you say?
There's so much money put into the treatment as somebody develops a condition. There has to be more time and attention put on. Really, it's the beautiful thing, and this is what I learned after just asking Doc for help for the last 5 years, personally, just to understand what can be done. The answers actually are simple, right? We need all the clinicians. There's a huge gap there, so we need more attention on that. So I appreciate what the legislators have done this year to solve for some of that. We have some great crisis tools, right? The Crisis Center of Tampa Bay is fantastic. So when people do reach that point, we have that. But the biggest thing has got to be, if we don't get ahead of it, what is the answer? So the simplest answer is maybe not a clinician every single time. It's a friend, it's a relationship, it's back in our community, it's in our churches. I told Doc a long time ago, I said, everything that I needed to know that I've learned from him, I actually probably was taught in church when I was 8 years old, right? And so the simplest answer is, the good news is, it doesn't always take a therapist, but we've got to have them available, and we need to help people figure out when, help them understand if they're not okay to go get the help that they need.
Well, thank you for joining us today on this important conversation. We really appreciate you making time for us.